Thank you, Mr. Chairman. And gentlemen, I appreciate you both being here. And I appreciate your expertise and your lifelong endeavor to figure this program out and how to take care of our. But it's on. Microphone's on. I appreciate your expertise in looking at this process. As I think the validity of this conversation has already actually happened today because of the fact that we're hearing issues that are real and things that have to be looked at. And I appreciate the opportunity to look at this over the next couple of years as this Congress continues to roll out on how do we make sure that we don't have hungry, our fellow Americans are not hungry. How do we ensure that? And what does this program do? And I look at it, I've been involved in international feeding programs. My husband and I lived in Eastern Europe for 4 years, and we worked in the sewers with kids below ground that were trying, escaped from dictator communism. And we found hunger there, saw it, actively did something about it, found hunger in my district, in the 2nd District of Indiana, devastating populations of people that are trying to make this work. And I guess as we've talked about today, we've talked about the issue of how do families, how do single moms, and how do underemployed families pay for food and health care and lodging and daycare? How does all this happen? And my question is, when they finally get to a point where they have figured all this out, what then does the government do to really help these families? Is the SNAP program historically been just a Band-Aid to pass them on to the next somebody else to deal with them? Or is there a sense that, there's an opportunity to actually look at what this government can do, should do, and actually getting real help to the financial challenges and how this happened to begin with? So I guess just historically, where do you see this? Has this always just been a Band-Aid to try to get people along, or is there a long-term solution that's been talked about?
Well, I think the world's changed. Before 1996, we would have had this conversation about TANF. And what happened was when the Congress reformed TANF and the caseloads went way down, the SNAP caseloads over time, over a 20-year period, went up. And as I said in my testimony, some people, on the right especially, call SNAP Welfare 2.0, which is, this is the new version of that. The difference is that within the SNAP program, the states don't have an incentive to really reform, to provide those kinds of uplifting services because of the formula. The formula is if a state wants to provide services to people in your district in Indiana, it has to pay 50% of the cost. But if it wants to just give out SNAP benefits, it only pays the administrative costs, and those are very low. So my recommendation is that you get whatever the incentive is, whether it's giving the states a bounty every time they get somebody from SNAP a job or an advanced degree or whatever, give them a financial incentive to help the people on SNAP. It's not there now.
Is there any sense of stewardship on the government's from the government's perspective once somebody is on SNAP? This issue of trying to figure out what keeps them from recurring, what keeps them from getting back on. In the government sense, is there anything that actually looks to ever really help these families stay out of? Do states check on them? Do social workers check on these people? Is there a validity that somebody really cares about what happens to these people, or is this just simply we've declared the program worked if they just are no longer a beneficiary?
That's a tough question to answer. I think it depends on the state, it depends on the governor, and it depends on the timing. Many governors, Republicans and Democrats, want to address these long-term problems.
Do we mandate, does the federal government mandate, have we ever mandated that somebody seriously track these families and see what's working, what's not working?
In myriad ways. The problem, when we as a collective impose those rules on the states, suddenly all we've done to the governor and the Secretary of Health or whatever, or food stamps or welfare, is his or her job then is, have I met the federal mandates? Have I met the federal mandates? And so what we have is we have some members.
Real quick to Mr. Greenstein.
Go ahead.
Could I quickly note?
Yeah.
There are very different kinds of people on SNAP. If you look at the people who got on between 2008 and 2012, A quarter were off within 4 months, 52% off within a year, 67% off within 24 months. A lot of people don't need other help. They're on for a temporary period. Other people their problem is just their wages are low, and they need a supplement. So
I appreciate it.
there's a smaller group that needs more
Right, I
substantial
hear you. I appreciate it.
help.
I look forward to the continued dialogue. I think it's very, very good that
Joe-
we're having the conversation. Thank you, Mr. Chairman.
Gentlelady's time has expired. Mr. Aguilar,